Okay. Which of the following genetic factors is most commonly associated with an increased risk for developing Alzheimer's? A 75-year-old man presents to his primary care physician with complaints of memory loss, confusion, and difficulty performing tasks. His wife reports that he has become increasingly forgetful and has difficulty recognizing familiar faces. A diagnosis of Alzheimer's disease is expected. Which of the following genetic factors is most commonly associated with an increased risk of developing Alzheimer's disease? Um, I'm leaning towards apolipoprotein E4. I don't know why the other one. So I would give it a Huntington gene expansion. That's Huntington disease, presenilin 1 and 2. I mean, I really don't. I know that presenilin has something to do with something. I really don't know what it has to do, but I know for sure A is like is a risk factor. So I would go with that.
Okay, good. Yeah, I can't remember right for the worst of me, right? But yeah, so it can increase, right? Most common genetic risk factor for developing Alzheimer's associated with increased risk of developing the disease at an early age of onset. So beta amyloid precursor protein. This is early onset, right? So I just
Okay.
want you to remember that, right? That I do remember, right? Which is a rare form that's typically before the age of 65. So this is the tricky
Oh,
part.
you're
He's
telling me. Okay.
75, right? And so this is early onset, right? Huntington's, right? Not associated with Alzheimer's disease, but Huntington's, as we know. And just remember, penicillin 1 and penicillin 2 also associated with early onset familial Alzheimer's disease, right? That lead to altered processing amyloid beta proteins, accumulation of amyloid plaques. However, these are less common in the than the APO4 allele in general population. So, kind of difficult one, right? Because these three are actually early and familiarity, but this apoprotein E4 allele, right, is going to be kind of the general population, older onset Alzheimer's. So
Cool. Cool.